Hello and welcome. I'm Dr. Raj, a practicing anesthesia doctor in USA, and thank you for tuning into our live session on Ask the Experts. Our goal is public education. We bring in leading specialist doctors from around the world to help you get the correct information based on what is scientifically tested by doctors or based on their experience or both. In spite of their busy schedule, these specialist doctors come on a voluntary basis to help answer your questions. No matter what part of the world you're watching this from, we want you all to be happy and healthy, and this is our attempt to get you correct information to your doorstep. Check this link to check other videos on the channel. In the last year or so, many people have debated whether to postpone pregnancy or not. Today, we are fortunate to have two senior OBGYN or obstetric gynecology experts who will answer our questions related to pregnancy and also some related to pandemic. So watch this video till the end to get benefit from this. I want to welcome the live and returning viewers. If you're a returning viewer watching the replay, remember this is a long video because we tend to cover many important things. You can always scroll to topics that are important to you in the video or by looking in the description below. If you're interested in learning about other topics, do leave it in the comment section below. So today, I'm very honored to have two guests here. Our first expert is Dr. Mamta Gowda. Welcome, Dr. Mamta.
Hello.
Dr.
Thanks for
Mamta.
yeah.
Dr. Mamta is a senior obstetrician gynecologist in the Department of OBGYN, Fetal Medicine and Genetics at a prestigious institution, JIPMER, in Pondicherry, India. Our second expert is Dr. Pradeep MJ. Welcome, Dr. Pradeep.
Thanks, Rajiv.
Dr. Pradeep is a very senior obstetrician gynecologist and works in Doha, Qatar. I have two exciting things to share with you about the experts. Number one, all three of us went to medical college or medical school together, and we're all alumni of Bangalore Medical College in India. The second interesting thing is both Dr. Mamta and Dr. Pradeep are great artists. So I have to show you Dr. Mamta's art. So here is Dr. Mamta's art, and let me show you Dr. Pradeep's art. So this is the image that was used in the thumbnail that Dr. Pradeep created. Nice work. And here is an amazing one. So Pradeep, what do you sell these or what do you do this for?
Well, as you know, when COVID started, a lot of things have changed. And one of that is I got more time to do because all the travel time was reduced. So I started painting. I don't usually sell them, but if anyone wants and commissions, yes, I do them.
Okay, there you go. If you need to buy any of this art, leave it in the comment section below and I'll try to work it out. I don't get any
And
financial benefits, but it's for you to get it.
a warning though, they are quite expensive.
Oh, there you go. Well, it's done by the experts, so it better be expensive. So I'm about to ask you, in spite of your busy schedule, how do you maintain your kalakar or artistic skills?
You know, Raju, there's a saying, you always have time for things you love.
There you go. Well said. Well, I want to tell my viewers, if you're here for the first time and still not subscribed, I encourage you to subscribe and hit the bell icon so you get an update when I release or I'm about to release a new video. Hit the thumbs up like button and share this video so more people can get benefit from this. Do type your comments below, and if you have any questions, we'll try to get to as many as possible. So I want to show a quick disclaimer, and you can find this disclaimer in the description below. If you want to come on screen and join live to ask a question, you can do that too. I will leave a link in the comments and you can simply click on it to join to ask a question. So let me get this started with Dr. Mamta. So with the, last year or so, a lot of people have had questions. Should I postpone my pregnancy or should I just be continuing as usual? I mean, is this even a question? What do you think about this?
Yeah, during the COVID time, initially we used to say, yes, maybe it's a good idea to postpone the pregnancy because we didn't know how exactly women may fare or what will be the effects on pregnancy or on the baby. But looks like this pandemic is just going on and on and on. First wave, second wave, we don't know whether there is a third wave or not. So as such, yes, like postponing might have been a good option in the initial phase of pandemic, but as more and more data is available and we know more and more about the disease, it's okay to, I think, go ahead with the pregnancy, especially those who have been trying for quite long time and they had any difficulty in conceiving. In such women, there need not be too much of a like panic about having pregnancy during these times. Oh, that's what I feel. Maybe Dr. Pradeep can say a few more words about it.
Well, yes, as Mamta said, initially everybody thought they will postpone, but as a effect of lockdown and work from home, actually pregnancy rates increased during pandemic, right?
So, yeah, everyone has spoken.
So
Yeah.
yes, so if couple have been planning to become pregnant and they've been trying. There's no need to wait, but as you rightly said, we don't know it wave after wave, and fortunately, the vaccine has come, and all the methods that we have been using to reduce the risk is working. So, and if every precaution is taken, and if they do get COVID, it is usually asymptomatic or have mild symptoms. So just for that, postponing a lifetime event may not be the right thing to do. Of course, if they can, it's a good idea.
Okay, that's great. So let's say someone gets COVID infection during pregnancy. Can it get severe, Dr. Mamta?
Yeah, most of the women who get COVID-19 during pregnancy, or as Dr. Pradeep rightly pointed out, are asymptomatic. So more than two-thirds of them, they say 75% and more than that, will be asymptomatic. And even if they are symptomatic, most of them are likely to have very mild symptoms like cough or fever, such flu-like symptoms. But of course, there is always a risk that some women may have severe disease. This is especially common in the third trimester. That is what the studies have shown. So, especially the ICU admission, women requiring intensive care unit admission have been shown to be increased in the third trimester. But really, this has not been shown due to severity as such, but it may be like a low threshold for admission of pregnant women who are has having respiratory compromise. That could have been the reason. So, as such, it's kind of it's asymptomatic and it is mildly symptomatic. So there is not much of a worry. However, our experience in India, we have seen that during the first wave, everything was going fine. But in the second wave, we are seeing that the severity has increased. So, especially if the women have required oxygen therapy or they needed assisted ventilation, in such women, most of the women we have kind of lost them. So, if at all, if it becomes severe, then the deterioration can happen very quickly. So, but then, of course, if one is planning pregnancy, this should not demotivate them because mostly more than 95% they are going to have a normal outcome. Maybe Dr. Pradeep can share his experience too.
Hello, yeah,
Yeah.
we're still live, right, Raju?
Yeah, yeah, yeah. Go ahead.
Okay, so yeah, that's absolutely right what Mamta said. Just to add, those who have some pre-existing morbidities, like those who are diabetic, those who have obesity, they obviously, even with or without COVID, they are at increased risk of morbidity. Okay, so compared to non-pregnant women, pregnant women, if they do get COVID, most of them are fine, but when they have severe infection or end up in ICU, the mortality is slightly increased compared to general population. And of course, that depends on the skills available, the facilities available, and where they are admitted. All those factors, general factors, do play important role. So therefore, those with pre-existing problems or those who are at risk of developing pregnancy-related complications should be more careful, i.e., they should be seeing their physician and healthcare team more often so that they can identify if any other complication is happening during pregnancy.
Yeah. Okay. I hope nobody gets COVID. Not only during pregnant, I hope nobody ever gets COVID. But realistically, that won't happen. And there are so many different medicines used for COVID. The list is unbelievable. So if someone gets COVID, lo and behold, during pregnancy, is there any restrictions in any of those medicines, or can they take all those kinds of medicines? What do you think, Mamta?
Yeah. Most of the medication that are used in non-pregnant can be used in pregnancy. However, there are some concerns about some of the drugs. For example, remdesivir, they say it's better to avoid that in pregnancy because data is not available and the safety profile, we don't know how it is. So, but then that said, most of the guidelines state that like that should not restrict, though there is a restriction on its use, but if the benefits outweigh, maybe like that can be considered too. But of course, with the multidisciplinary team involvement, maybe opinions of other specialities also to be required. And as we know, remdesivir is usually used in the early stage of the disease. So if it is beneficial, yes, of course, but there should be a caution while using it. And the rest of the medications, such as steroids, we have been using in pregnancy, so there should not be much of a concern about it. And also the blood thinners, we know the safety of low molecular weight heparin that we use as blood thinner in pregnancy. And there are usually no concerns about their use in pregnancy too. And as far as the interleukin 6 antagonist is concerned, even that has not shown that, like there are no data available, but still there are no concerns raised on its use in pregnancy. And they say, like recommendations say that if there is hypoxia as well as if there is a systemic inflammation, as depicted by the CRP that is increased, so there is a role for using these drugs also. So, as such, the other drugs such as hydrochloroquine and those things, but that we used to use initially, azithromycin, hydrochloroquine, these have not shown to be effective. But even though there is no concern about their safety profile, but these have gone out of vogue. They are no longer used during pregnancy. And this is what I feel are the latest development. Maybe Dr. Pradeep can share his experience.
Yeah, that's pretty much what it is. I mean, in pregnancy, remember, a lot of the drugs and medicines we use in pregnancy, they're not really being tested in randomized controlled trials. That's the type of research people do to see whether medicine is safe. And again, we don't know the long-term effects of many medicines. So the bottom line is two things. One, use them, but only when absolutely necessary. Use them only when you know that, or you with your patient, it's a shared decision. You talk to your patient. Look, the benefits is probably more than any perceived or actual risk, then those can be used. Okay. So one medicine that we use in patients if they have bleeding after delivery, what we call postpartum hemorrhage, is called tranexamic acid. It helps in blood clotting better. So with the risk, as you know, pregnancy itself is a condition where the risk of having clots is increased. So in those situations, if COVID is also added, that is another risk for increased clots in the blood. So if possible, we should avoid tranexamic acid, and any medicine which are not of proven benefit should be avoided. And the medicines which are used like remdesivir, where we absolutely have not much data except few case reports, should be avoided. But the common ones which you have been using for long term, like paracetamol, steroid, and some safer antibiotics, they can be used.
Okay, great. So, Pradeep, tell us if a young girl or women of childbearing age get COVID infection, you know, do they get infertility in future? Can they still have normal babies?
Okay, so when COVID came and also the vaccine, there have been all so many myths. Okay, so COVID infection does not cause infertility. Of course, there are infections which can cause some fertilities. For example, chlamydia, gonorrhea, pelvic tuberculosis, but not COVID. There's not been any association of increased risk of subfertility after COVID infection.
Okay. So, Mamta, when should
Yeah.
pregnant women get vaccinated? I mean, can they even get vaccinated? I know we talked about this topic with other experts. I just want to get your perspective as a obstetrician gynecologist as to what you think about it.
Yeah. Now there is a lot of data available on vaccine use in pregnancy, before pregnancy, and in the postnatal period, that is in the lactating mothers. Of course, in India, we do not have it. I'll talk about it in a while. So, lots of vaccines have come up for COVID-19, and most of these trials that they have done, like the use has been in US and UK only. I mean, the vaccine usage in pregnancy. And it has been shown that it is quite safe to use in pregnancy. And they say, like, recommendations say that it can be used at any trimester in pregnancy. But maybe if a woman wants to avoid it in the first trimester, say, for example, first 12 weeks, about there could be concerns about teratogencity, that is, that the vaccine may cause some anomalies in the baby or not. Even this is not proven. But if they do want to avoid it, then maybe that can be supported. But then, as that said, since severity is noted to be increased in the third trimester, so if at all, if they're opting for vaccination, it should be preferably completed both the doses before 28 weeks. Though one dose, single dose, has also been shown to provide some protection in the women, but double dose, completing the vaccination schedule has shown to generate more antibodies, which could be protective for the baby also. That is, these antibodies get transferred across the placenta to the baby, and maybe it could provide some immunity to the fetus also. So, therefore, the vaccines have proven to be safe, and there is a lot of data, more than I think already, like 123,000 women as of now in the VSafe app, the registry that is there in the US, have been vaccinated, and there has been no safety concerns raised over it. However, in India, we are using this Covaxin and the Covishield, and the Indian government, the MOHF, has not given clearance to its use in pregnant women, though it has cleared it for usage in lactating women. So we do not have first-hand experience on the effects of vaccine in pregnancy in our population. But going by the data that is available worldwide, I think it is safe, and it may be even, it should actually be recommended, because we are seeing more severity in the pregnant women, and it has been proven that the vaccine provides more than 80 to 90% protection, and there is no reason why this particular group of women, like, population, should be excluded from the benefits of vaccination. So that is what I feel, and I think slowly, like very soon, India will also approve its usage in pregnancy, and we will see more and more data on that. Yeah.
That's a great point. So, I have a question from the audience. I'm going to broadcast on this screen. It says that does COVID cause premature birth? Pradeep?
Yes.
Right. Okay. So, yeah. Shall I take it, Mamta?
Yeah, go
Yeah,
ahead.
yeah, sure.
I don't want to go me first, me first. Okay.
I know
We're
you
not getting any
guys tell
brownie
it
points,
from.
do we? Raj?
You first, you
Okay,
first from my
right. That's a very important question. Okay, yes. One of the concern is when pregnant women get COVID, do they run the risk of having baby prematurely? So I don't want to go into figures and data. The the overall risk of having baby early if pregnant women has COVID is higher compared to other pregnant women. But this is mostly iatrogenic, which means because of either complications related to COVID during pregnancy, which are slightly increased, like diabetes or hypertension, we tend to deliver them early. So it's a controlled delivery. But if that is not required, if pregnant woman is going normally, then the spontaneous preterm birth risk is not increased. It is similar to background risk of premature labor without COVID. So most of it is because of the complications that we might need to deliver the baby early. If there are any safety concerns for the baby, for example, if the heart beat changes or if baby is not growing well or mother develops complications like hypertension or diabetes, then we may need to. So overall, that risk is almost double the number of premature deliveries that would have happened in the absence of COVID.
Hmm.
Hope that's clear.
No,
in
that's
in this regard, I would like to like share our experience also. Like
mm,
as Dr. Pradeep said, it has been shown that the preterm delivery rate is increased in COVID positive pregnant women, and most of it is iatrogenic. So we have also seen this increase, but as Dr. Pradeep said, it has been mostly iatrogenic because women have decompensated in the especially when they present in third trimester. We have not been able to maintain the oxygen saturation. So, in such cases, a decision had to be taken to deliver the woman so that resuscitation becomes better. So, we had to either resort to cesarean section or maybe induction of labor. Mostly, it has been cesarean section to better stabilize the mother. And this has also led to the increase in the cesarean rates. It's not like because of COVID itself, we need to do the section, but to make it better, I mean, oxygen saturation and the mother's condition better. So we may have to take a decision to deliver her earlier. So this could be the cause for increase in preterm labor that we are seeing.
mhm. That's a great point, and thank you for that question. I did not know that myself, so I learned something new. So, if someone gets COVID infection and they are not able to get pregnant, obviously they start feeling guilt. They blame themselves for having that COVID infection. So, when should people start worrying? Is COVID even a contributor? I know you touched upon it, but when should people start worrying if they are not getting pregnant?
So,
Pradeep?
uh,
Okay. So as I mentioned earlier, COVID is unlikely to be the contributor.
Mm-hmm.
If they have been trying for pregnancy for a while, say for example, somebody who is young, less than 30 years, been trying properly for about 6 months to 1 year and not got pregnant, then they should consider seeing a specialist. And that when do they see them depends on various factors. Okay, so if they have any other risk factors, what's their age, do they have enough time or is the biological clock ticking? So depending on the age, they should see the specialist. If they had COVID and once they have recovered and they have tried, say, for 6 months and still not getting pregnant, yes, they should see them. But as I said earlier, again, COVID is probably coincidental factor, and yeah, you have something to blame, but that may not be the cause. There are various causes, various factors that might be contributing for not to get pregnant.
Mm-hmm. So, Mamta, if someone gets pregnant, you can
Mhm.
think this as a general question. What supplements should they be taking during pregnancy?
yeah, generally the supplements, not many are needed in pregnancy because most of the things should be available in the diet itself. So, in the developed countries like UK or US, it is like usual to give only the 2 or 3 vitamins that are used as a supplement, such as folic acid is usually prescribed at 400 microgram per day dose, and maybe a higher dose if there are any risk factors, like if the previous baby had some anomalies known as neural tube defect, or if they are overweight, or if they have some hemoglobinopathies. In such cases, a higher dose is may be needed, like 5 milligram instead of 400 microgram. And the other vitamin that is generally supplemented is vitamin D. And these are usually may not be required. Vitamin D is not a supplement that we generally offer in pregnant women in India because we have plenty of sunlight, so they don't usually need that. But folic acid, of course, we prescribe. And in the Indian scenario, we also supplement them with iron. As you know, like the anemia is one of the killer factor in India, especially along with the hemorrhage that occurs in the antepartum or the postpartum period. So we have a need to supplement women with iron in countries like India, but this is usually not the case in UK or US. So usually this folic acid and vitamin D are the ones that are given as a supplement, and sometimes vitamin K may be required if, especially if women are epileptic and they are taking some drugs, anti-epileptic medications, and sometimes vitamin C may be prescribed when they are anemic, along with the iron to increase its absorption, not for supplementing vitamin C as such. So these are the things that are usually supplemented in pregnancy. Other than that, most of the nutrients are available in the diet. And if the woman takes a healthy, balanced diet, that should be sufficient to meet all the demands.
Hmm. So, for our viewers, I'm going to leave a list of those supplements that's required in the description below, which Dr. Mamta will share with us. And Pradeep, people love drinking coffee. They love drinking tea. Well, what do you think about that? Can people continue drinking coffee and tea during pregnancy?
That's an important question, You try telling somebody who love coffee or been drinking coffee to
I
stop. It's
would
difficult. Having said that, I had to stop drinking coffee because of reflux. So I've managed.
Okay,
So yeah, does it
not
cause
during
any harm?
pregnancy though.
Yeah. So anything in moderation is okay. But if somebody has been drinking too much, then it's not good. So it causes various effects in pregnancy. But what is right? How much can they have? So that might be the next question, right? So
Hmm.
can they have coffee? Yes, in moderation. And how much is that? So far, the recommendation was like 200 milligrams of coffee, which is like 2 cups. But recently, there have been few studies who showed that even that is a bit high. So now maybe need to reduce it to 1 cup. And if possible, if you can replace with some other drink like milk, then that would be better.
Okay,
So yeah, but if they do drink, it doesn't cause like severe effects. So if they can reduce to moderate levels, less than 2 cups, and preferably 1 cup, and even better, no cup. That's
okay,
what is advisable.
okay. So again, the cup size can be variable. You walk into Starbucks, they have five different sizes, all the way from a tiny thing all the way to a gallon. So is this a,
Correct.
this a reasonable sized cup? You think this is
this
about
would
That's
quarter liter?
that's Raj. That's American size. Everything is big there.
All right, we have a
So
question from the
if you
audience.
yeah.
The question is, after how many days postnatal mother can take vaccine? Is there any cutoff? Mamta?
Yeah, there is no cutoff as such. As we previously discussed, the vaccine is safe in any stage of pregnancy itself, so there is no reason why there should be any cutoff to use it in the postnatal period. It's better to give it as early as possible, as soon as possible when the woman desires it. And as far as I know, there is no cutoff as such. Dr. Pradeep, anything regarding that?
No, absolutely no. They can take it anytime when they are ready. It's good to see a lot of participation from audience, Raj.
Yeah, no, I have
I
to.
know
Yeah.
you have told, yeah, you have told us to keep smiling. That we don't smile much on the camera. I'm trying my best.
You're doing a great job, man.
Vaccination in the post period also, like studies have shown that the antibodies generated will go in the breast milk. That's found in the breast milk also. So it could be protective, but there are many types of antibodies. Usually, the breast milk antibodies that are protective to the baby, or known as a group of antibodies known as IgA. But what has been observed in the studies are that this COVID vaccine has generated IgG, which is preferentially transferred to the breast milk. And they have found that IgA antibodies as such are lower in amount. So we don't really know how much it might protect the baby as such, but definitely it is going to protect the mother. For that sake, at least we should recommend giving it in the lactating mother. So maybe in future we will know how much it could protect the baby neonate also.
All right. So, Pradeep, there is another question from the audience. They say, thanks for a great discussion. I have to thank you all for being so interactive. My question is, what is the outcome of pregnancy if the mother is having a moderate to severe COVID? You might have touched this a little bit, but if you want to briefly say.
So yeah, if patient had absolutely no other comorbidities such as diabetes or pre-existing hypertension, the outcome is usually good. If they do decompensate, especially in third trimester, they might need early delivery, usually by cesarean section. And if they don't go into severe state requiring ICU care and all the treatment for severe COVID, the outcome is usually good.
Okay, that's great. Mamta, there is another question from the audience that says, I got up to, I got positive after 1 week of Covaxin second dose. Is there any chance of problem with that?
Uh, with Covaxin, we don't have actually much of a data, but then there is no reason why there should be a problem with that, because it's known to be a kill vaccine, and it doesn't. Usually, the live vaccines are the ones which are contraindicated in pregnancy. So none of the live vaccines have been approved for use in pregnancy. So none of the vaccines are likely to cause any problem in the mother or the fetus as such. Its mechanism does not permit any harm. But that said, we do not have data, but mostly the studies have shown that it is safe, and we use such kill vaccine in pregnancy, such as like we use influenza and the whooping cough vaccine, the Tdap vaccine, and these have been shown to be safe. Since the mechanism is the same, so there is no reason that there should be any problem. And even so, with messenger RNA vaccines that are available abroad, like US and UK, even those, their mechanism is kind of a foolproof mechanism, and they do not actually, virus does not actually replicate, or it doesn't cause any such side effects on the baby, and there is no risk of malformations also that has been shown. So I don't think there should be any problem even if it is taken during the organogenesis, that is in the first 10 weeks of pregnancy. There is no reason why it should cause any harm to the fetus. So I don't think there should be, like the person who asked the question, I don't think there is any need for her to worry about it.
Okay, thank you. That's very.
Yeah,
Mhm.
I think the whoever asked that question, their worry was because they got COVID infection after having vaccine. Is this is there any chance of problem with that? No. So answer is no, because I think having COVID after vaccine, vaccine doesn't prevent COVID 100%. People do get COVID, but the risk of having severe infection requiring all these ICU admissions and all is much, much lower. The death rates are lower. So after having vaccine, COVID infection is much milder. So that is the advantage. So will there be any long-term effect? Vaccine produces antibodies, infection produces antibodies. If anything, it would act as a booster. So not to worry at all.
Yeah, true
Thank
that.
you. All right. There is another question. It's on the screen. You might have touched this. So here's what happens. We have viewers coming back and forth because this is a live platform. So is there any risk of teratogenicity associated with COVID-19 infection? So teratogenicity is anything that can affect the baby. So Mamta, if you want to take this, I know
Yeah,
you have
yeah.
answered this. So if you want to briefly say anything about it.
Yeah, sure, sure. So there is actually a lot of data available now about the COVID infection in pregnancy as well as vaccine intake in pregnancy, and I'm not sure if there has been any categorization as to whether the effects of preconceptional or a first trimester infection, second trimester, third trimester, something like that has been categorized and effects have been seen. As such, the overall data indicates that there has been no teratogenicity reported as so far. So, background risk of anomalies itself is usually 2 to 3 per 100 women. So, over and above that has not been reported due to the presence of COVID infection itself or due to vaccination. So, definitely there has not been any concern raised with regard to this teratogenicity issue.
On the same note, there is a question that says, what is the risk of vertical transmission due to COVID? So, vertical transmission is what happens from the mother to the baby. And is there any reports of stillbirth? Or, yeah, Pradeep.
Okay, so we know that if pregnant woman is COVID positive during pregnant, and if at the time of delivery, there is slightly increased risk of babies having COVID, and that risk has been shown to vary from 2% to 12%. Okay, but when does the exact transmission occur? Is it through transplacental, or is it at the time of delivery due to contamination with the body fluids and blood, or is it at the time of breastfeeding? That we don't know. But what we know is that whatever the risk is very low. So that's why if woman is positive for COVID, babies are tested 24 hours, 48 hours to check if the baby is positive.
Okay.
It's thought though that most probably, it's mainly at the time of delivery that there can be an infection to the baby. There was also a question of teratogenicity, which I think Dr. Mamta has already answered, right?
Yeah.
Yeah, actually, we also have some data with regard to this, the vertical transmission and the horizontal transmission that we call as, that is the transplacental transmission. So in the JIPMER itself, one of our department consultant, Dr. Shashireka, and another consultant from neonatology had done this study. So they had initially seen during the initial wave itself, they had seen what is the, like, whether the virus is found in the amniotic fluid or in the vaginal secretions or in the breast milk and also in the baby. So far, we have not come across like any positive neonates. Like vertical transmission, also we have not come across. And also, when the, like, there could be concerns that the virus may get transmitted when the woman is in contact, the COVID positive woman is in contact with the baby, and if she is breastfeeding, even then the transmission to the neonate has been shown to be like very negligible. So I think there should not be any concerns about this vertical transmission or even from woman to child transmission. And even if it is like found to be positive, there has not been like no increase in the severity noted in the neonate. So like we recommend that breastfeeding and contact with the woman should not be restricted for this reason alone.
Okay. So during pregnancy, tiredness can be a problem. I mean, even without pregnancy, I'm always tired. If you ask my wife, I'm the most tired person she has ever seen in the whole world. So, always tired. So,
Yeah,
what's that? Everywhere.
at home, at home, all the chores to escape.
So, question is, what suggestion do you have? So, someone to, you know, are there any activities they can do to improve their activity or energy, Pradeep?
Yeah, well, pregnancy can be very tiring. But as far as your tiredness is concerned, Raj, you might want to check your anesthetic machines if there is any gas leaking there.
There you go.
They might be causing your tiredness. So yeah, pregnancy can be very tiring. But if a woman comes to me telling that she is tired all the time, we need to make sure are there any underlying causes. So there can be conditions which can exaggerate that pregnancy induced tiredness. For example, anemia. Anemia is the commonest one. Okay. Is she diabetic? Diabetes can also be, especially hypoglycemia and hypothyroidism. So once you rule out all these conditions, then we can reassure them and then advise some exercises, uh, routine daily exercises that they can do. If they've not been doing, they might want to start gently. If they have been doing before, they can go back again gently and slowly, listening to their body, how they can do it, and that might improve. That's one of the medicines. Exercise is new medicine for tiredness. You may want to buy a treadmill, Raj, for yourself.
Hmm.
That might be a solution. And if they're found to be deficient, such as iron, again, that can be a cause. So we might need to put some supplements, iron supplements for them.
Okay. So iron supplements is very important, right? This is one of the key things to include in.
Yes, absolutely, especially in areas where iron deficiency is very prevalent, such as India, it is important.
Mhm. Uh, so I do have a question from the audience that says, if the mother contracts COVID in the perinatal period, should she still keep breastfeeding, or should she avoid contact with the baby?
Yeah. I think we touched upon it before. So, of course, breastfeeding is not contraindicated even if the woman is COVID positive. So, in especially in countries like India, we just recommend breastfeeding. However, if the woman's condition is good, she is well enough to feed the baby, there should be no restrictions. And like ICMR recommends, like ICMR is the body in India which gives out some recommendations related to this. So according to that, the woman should be wearing a face mask and maybe a shield also, but it is not necessary that the baby should wear a mask. I mean, you should not actually put on a mask on the baby or a shield on the baby, but because there is a risk of suffocating the baby. As we previously discussed, the risk of transmission has been shown to be very less, and the benefits of breastfeeding are far more than the risk of transmitting the COVID virus to the baby. Hence, there should be no restriction in feeding the baby. However, if the woman is very unwell, like if she has the severe or critical COVID, if she's not able to breastfeed, then as such the milk quantity produced may be less, or she may be quite unwell to feed the baby. In such cases, maybe an expressed milk can be like breast milk can be expressed, and that could be fed to the baby. And sometimes the baby may be sick, that like it could need neonatal support. And in such cases, baby may not be able to suck and feed on the mother. In such cases, also expressed milk may be given. And in extreme situations, maybe a donor, like a lot of donor banks are available now, like breast milk donors are there. From there, we can give the milk to the baby, if at all, if mother is not able to feed. And as a last resort, formula feeds, but we try to avoid it as far as possible. So the bottom line is breastfeeding is quite safe even if mother is COVID positive, and it should be supported and should be recommended in COVID positive women also.
That's great. Next question. Very nice discussion. Thank you. There is an excellent question, Pradeep. Can women undergoing fertility treatments safely continue if they get a COVID infection?
I think I recognize that name.
A lot of names we
Okay.
recognize.
So it really depends what stage of treatment they are in and how bad the COVID is. So if they already have, say, egg collected and fertilized, and women develops COVID infection and it's quite severe, it might be better to freeze the embryos and to for the later implantation. It a lot of it is unknown. We don't know. Okay, we don't have many such cases. Should it be postponed or should it be done? If the treatment cycle is in such a phase where you cannot stop, for example, somebody has given HCG and egg needs to be collected, then if patient is stable enough for the egg collection, that should be done. If we can delay embryo transfer and patient is having severe infection, then it's better to avoid it, let the woman recover from the infection, and then embryo transfer can be done.
Yeah. In this regard, I would like to add that though fertility treatment should be there is no reason why it should be stopped and why it should not be started. But the burden of COVID disease itself has got all these services to a stall, especially like this has become a low priority area for us. Like we are
Correct.
treating COVID and other morbidities, and we don't have even have beds for even delivering the women who have already conceived. So at present, we are like most of the units are holding this fertility treatment, but it's not because it should not be done or it cannot be done in during COVID time, but it is because of the logistic issues that there could be some delays, and like it could be like from the physician end there could be postponement of these treatments.
Hmm.
Very true. Because the priority, especially like in, for example, Qatar, some of the hospitals were completely changed to only for COVID hospitals, and at some points, all the elective services had to be stopped so that the COVID takes priority. So that's a very valid point. Thanks, Mamta.
Yeah. Yeah, I know you both are very busy. You have a lot of things doing on. I have to be respectful for your time. And I think we can take one more question. Uh, Pradeep, it says in pregnant women who are vaccinated, is there transmission of antibodies to the baby?
So, question is, does the antibodies produced by vaccine protect the baby, right?
Correct.
So again, yeah, so we don't have much data for that, but we know, especially if the antibodies produced by vaccine, the duration of how long it lasts. With the current studies we have been monitoring, up to 80-90% in some vaccine, the antibodies have been seen even after like 6 to 8 months. So I'm hoping that these antibodies will have some protective benefits to the baby, but these have not really been formally studied. So it will be premature for me to tell yes or no, but looking at how it works, it will provide hopefully some protection to the babies. We
Hmm.
can
Yeah,
come back to that question again, maybe 6 months to 12 months time.
Sure.
yeah. In this regard, can I add one point? Like, I think some studies were there in US. I think two studies are there in some of the academic centers in US where they saw this after giving vaccination, they tested the cord blood and breast milk as well as like they compared it with the natural infection generated antibodies. So what they found was I think some 122 women were enrolled or something. I'm not sure, So in this, they found that the antibodies generated by the natural infection were less than what was generated with the vaccine. And that too, with the vaccine, first dose didn't generate much of a neutralizing antibodies, but after completion of second dose, they have seen that a lot of antibodies were neutralizing antibodies, which are enough to be protective, were generated. But as we like discussed earlier, these can be transmitted to the fetus, and in the breast milk also it gets transmitted to the neonate. But and they have found that the quantities are around 50% of what is found in the mother's blood. But still, this is likely to be protective to the baby. But the component that of the ratio of the antibodies as IgG to IgA ratio has been found to be a little different than what is seen in other vaccines. So we don't really have a data as to whether it's really protective to the baby or not. But of course, with more and more women getting vaccinated and more research into this, we'll definitely have good data on that. And as there is no harm in giving it, and there are no safety concerns, so we should assume that definitely it could be protective. Like benefit of doubt, we can give and go ahead with vaccination.
Mm-hmm.
Yeah, so it's as you said, the studies we have is very few numbers and very preliminary, and
So I think,
biological plausibility is there because antibodies will be transmitted. How much does it actually help babies
but
in preventing the infection? That we don't know, but we know certainly that it doesn't cause harm. If anything, it's beneficial in protecting. So in those terms, yes, they should have it, but the exact figures we have to wait.
Mm-hmm.
that's right.
So I have to thank Mamta and Pradeep for taking out their time and sharing all their expertise. I do want to remind that if you have a lot of money to spend, so I want to show Pradeep's art, which actually he said you can buy. Fantastic art. So you do leave in the comment section if you want to buy anything, and I will connect you with Pradeep so you both can work together. So thank you both. Thank you. This was very helpful, very informative. I do want to remind the subscribers, if you're still not subscribed, consider subscribing. If this type of content provides value to you, do hit the like and share button. And thank you for hanging out here.
Thank you, Dr.
Thank you
Rajiv, for
very much.
Thank
Thank you, Raj. And if there are any more questions, you can direct it to Dr. Rajiv and he can ask us. We can reply back through
yeah,
some other channels.
yeah,
Fantastic
definitely.
point. Fantastic point. Yeah, do leave in the comment section if you have additional questions and we will get it answered for you. Thank you and have a wonderful weekend and a week ahead. Take care.
Thank you.
Thank you.